Welcome. Good day. Welcome to the YMC Education Series. We are free and open to the public, so we encourage you to spread the word and share the knowledge that we learn at these talks. We host approximately 6 to 8 of these a month and varying in all different topics. The program will last about an hour, and you might find that you have questions during the program. Feel free to put that in the chat box, and I will get that question to Denise. Denise will allow some time, maybe like 5 minutes at the end of the talk for any questions that she can take at that time. Thank you again for joining us today. I would like to introduce to you Denise Schwartz. She is a licensed physical therapist specializing in treating pain using a holistic approach to discover the root cause of pain, provide natural healing options. Today's talk is Healing Shoulder Pain Naturally. Heal your shoulder pain and enjoy life again. This workshop will be for you if you have trouble sleeping on your arm. I do. You have difficulty reaching overhead, opening doors, or putting on your seatbelt. You're unable to participate in your usual exercise of choice, such as tennis, yoga, pickleball, or weightlifting. Welcome, everyone, and welcome, Denise.
Thanks, Pam. Appreciate it. Another couple little housekeeping things. Does everybody know how to use the chat box? If you have any questions, type it into the chat box, and then we'll take a look at those at the end. Also, if you would leave me your email and your name in the chat box, I can then send you some information as well, and I'll remind you as we go along. I think that's it. So thanks, Pam, for having me. I'm going to share my screen. Got one more thing to do here. Hold on. Trying to find the, oh, there it is. Okay. Okay. All right, Pam, you can see the PowerPoint. Can you see my mouse, the arrow moving around? Okay, good. All right, terrific. Okay, I'm going to close out so I don't see anybody's faces. So I won't see if you raise your hand or want to ask a question. It's just easier on these webinars to do them at the end. So if you know how to do it, type in your question in the chat box or any comment. If not, write it down and we'll have plenty of time afterwards. I'm happy to stay on as long as we need to answer any questions. Okay, so I have hidden everybody, including myself, so hopefully you can see me and we're doing okay. All right, so welcome. This is a webinar about healing your shoulder pain naturally. As Pam said, my name is Denise Schwartz. I am a physical therapist and owner of the Manual Touch Physical Therapy in Wheeling. I am at the corner, just north of the corner of Milwaukee and Dundee Road. So I'm a good, just a mile west of Northbrook. So you can almost call me Northbrook. I have one other therapist here, Kevin. So the two of us treat the same way and you'd be in good hands either way. I have been in my own practice for the last 12 years. I started my career at Lutheran General a very long time ago, over 30 years ago. I worked in the hospital and then concentrated the bulk of my career there in outpatient, which is what I am now, where patients come to see me in the clinic. While I was there, when I got out of school, I knew that back pain was the #1 reason people went to see their doctor. So I took a lot of continuing education to become an expert in treating back pain. And I became really pretty good at it. And then along the way, I started learning a non-traditional hands-on technique called integrative manual therapy. And I found that I could use these non-traditional hands-on techniques to help everybody. There was always some people that did not respond well to traditional physical therapy. It would flare them up. You know, people with chronic pain, chronic illness, they're very heightened sensitivity. They don't do very well with some very traditional techniques, but they all did well with these non-traditional hands-on techniques. So I left the hospital with my mentor and we started the clinic here in the Chicago area called Center for Integrative Manual Therapy, and we treated a lot of very complex medical and pain patients who don't get help elsewhere. And I really honed my skills and became certified in it while working with them. I think I was with them for 7 years in the current space that I am in now. And we parted ways in 2010, and I became the Manual Touch Physical Therapy. And what I realized is when I left the hospital to work for this non-traditional therapy company, I kind of threw out all the traditional stuff. And I realized there's a place for all of that. And I missed that component of it. So now what I did is I recreated my brand and my motto, and I used what's called a whole body approach of traditional and non-traditional therapy to get people back doing the things they love to do. Now, I know we're here to talk about shoulder pain, and I started out talking about back pain. However, over the course of my career of 30 plus years, I've taken many, many classes, and I see lots of people with lots of different pain syndromes, and I would call myself an expert in treating any type of pain issue, no matter where it's at. Along the way, I had developed a passion for running, and I began studying running technique and running analysis. And so now I also treat runners and am an expert in that as well. I am no longer running. I kind of gave that up a couple of years ago because I developed some arthritis in my big toes and wound up with surgery the last 2 years. So, it's time to maybe take up golf. So we work with golfers as well. So those of you who play golf. And there was a gentleman on earlier, we talked about pickleball, and we have seen our share of pickleball players. Okay. So now to talk about the shoulder. The shoulder joint is a very complex joint. It's a very flexible joint. It's called a ball and socket, and I'll talk about that a little bit more. And as such, because it's a ball and socket, it can move in a lot of different directions, which can set it up for easy injury. So how do we know if you have a shoulder problem? These are some of the complaints that people will tell me when they come in with a shoulder pain. I can't lay on my shoulder. I can't lift anything, I can't put a dish away. It hurts when I put my shirt on or taking my coat off. I can't blow dry my hair. Shaving is a problem. For women, they can't get their hand behind their back to do their bra. And reaching into the back pocket may be a problem. Opening or closing a door, reaching overhead. It's a real problem when you can't use your arm. We are always constantly using them. A common complaint that I don't think I have here, that seems really simple, but when people are in bed and they want to pull the blankets up, that will hurt. So there's a lot of different issues that people might have with a shoulder pain. This is an ebook that I offer you. You can download it off of my website, but I'd love to be able to send it to you directly. So if you leave your email and your name in the chat box, and I will send you this ebook plus a couple of other ebooks and some videos on how to take care of yourself. All right, so we're here to talk about shoulder pain. Now, there's a lot of different things that can cause a shoulder pain, but what we're going to focus on are the 3 most common issues that we see here in the physical therapy clinic. The first one would be what's called an impingement of the rotator cuff or bicep tendons. It might be also known as rotator cuff tendinitis, bicipital tendinitis, rotator cuff strain, rotator cuff tear. That all fall under that nomenclature. Frozen shoulder, or the official term is called adhesive capsulitis. That is very common. And then we have people who just have a wearing away of the joint of arthritis. This is your shoulder joint without all the muscles. And this is if you're looking at it from the front. Okay. So this is your arm bone, your humerus. This is that your backbone is known as your scapula. So this sits right on your rib cage. So again, we're looking from the front. This is if you took off your rib cage, you would see this bone here. This is your collarbone or clavicle. And then back to the scapula, it's got a couple of bony prominences that help where muscles around the shoulder joint attach. So your humerus bone, the shoulder, actually sits in this socket. It's called the glenoid fossa of the scapula. Up here is the acromion. I'm not sure why there's a bone there like that, but there is. And so that attaches. So the scapula has an attachment to the clavicle here called your AC joint. And so this would be someone who might have pain up at the top here. This is kind of more of like a sports injury, or if you fell really funny or hard, people might strain the ligament around in here, and that's painful. But most of the time, the people we're seeing have a problem around this area. So now here are the muscles around the shoulder. Let me see something. Okay, we got both. Let's see, we'll do this one. This is the front again. So this is the same angle that we looked at before. So the rotator cuff is literally 4 muscles that kind of sit and create a cuff over the shoulder joint, okay? And we can see 2 of them here from the front. There's one called the supraspinatus, which travels up here on the top of your shoulder, goes underneath that clavicle, and it attaches over here onto the humerus bone. On the inside of the scapula, between the scapula and the rib cage, is your subscapularis, and that, of course, comes through here as well onto the humerus. This is your biceps, and the biceps is called bi because there's 2 heads. You got one head here and one here. And you can see it's very interconnected with the rotator cuff. The main function of that rotator cuff is to hold the head of that humerus in the socket. So when you go to move your arm, it doesn't ride up like this. It should roll in the socket. When one of these muscles becomes inflamed, gets torn or frayed with overuse or injury, the stability within that socket, those muscles aren't working well, and it might, as you go to move your arm, it will jam into the edge of the socket. It'll pinch usually this muscle underneath the clavicle, and that's where you get that impingement and pain. This is the back side of your shoulder. So here we have the rib cage, and here's the scapula sitting on the back of the rib cage. Here is the humerus. This is the spine of the scapula. It kind of divides where the rotator cuff muscle goes. Here's your supraspinatus. And then you've got 2 other muscles. Remember, I said there are 4. We saw on the anterior view the supraspinatus and the subscapularis. On the posterior side, we have the infraspinatus and the teres minor. Those 4 muscles make up the rotator cuff. I don't have on here the muscles that go over here, the deltoid. You have your upper trap, which plays a role as well. But for our purposes today, we're just going to talk about the rotator cuff. Okay, so we got the rotator cuff here. I wanted to talk about, sorry, I lost a slide I thought I had. Oh, here it is. What is the rotator cuff? Okay, thought it looked differently. Sorry about that. Anyway, so the rotator cuff, as I said before, creates a stability and holds the ball of the humerus in the socket so it rotates appropriately, okay? That scapula, which we see here, when you move this arm, this scapulum will move in rhythm with the humerus bone. What happens oftentimes, well, happens all the time, but we don't quite know what came first, is when you have an injury or pain, this rhythm of this scapula rotating with your arm, let me see, it would rotate up like that, will go out the window. You lose all this nice control that you have from the muscles that surround the scapula. And so what'll happen is you'll raise your arm up and the scapula should, let's say you're raising both arms up, the scapula should do this and come back down. But what'll happen is it'll ride up way too soon, allowing this humerus to glide up and bang the muscles into here, and you get that impingement and pain. So the primary component of what we're doing in physical therapy is to reinstitute this scapulohumeral rhythm, so you have stability near your body so you can move your arm safely, and that rotator cuff will kick in and do what it's supposed to do. Okay. Sometimes people, in addition to the rotator cuff tendinitis, will have bicep tendinitis. And that bicep sits kind of right here in a groove. And if you kind of poke at it a little bit and you turn your arm a little, you can feel it in there. If it's sore, inflamed, or tender, it'll be sore. What I find is that sometimes people get pretty good therapy for that rotator cuff, but they still have a little bit of problem because somewhere along the line, this bicep component was missed. Some of the exercises I might give for rotator cuff tear, strain, impingement, people might not be able to tolerate if they also have a bicep issue. So we sort of have to figure those two pieces out. The other issue that we want to make sure is not going on is is there something coming from your neck? Because people can have pain on the upper part of their shoulder, down their arm, and it may be from the shoulder, it may be from your neck. So we have to look at both of those pieces. This is someone wrote me a nice testimonial. This is a woman who was actually a pediatric physical therapist, and I had a whole slew of them recently. As we've all become in our 50s, therapists who work with kids, it's a pretty physical job and very challenging. And so they're all kind of falling apart. So she wrote me a nice note here. Okay. The second most common cause of shoulder pain is a frozen shoulder, or technically known as adhesive capsulitis, in the joint right in here. This is your glenohumeral joint. This blue is the capsule. It's a cartilaginous tissue that gets thick and it creates adhesions. I'm not quite sure we know why it creates these adhesions, but what happens is it literally just gets stuck and you can't move. What happens when somebody has a frozen shoulder? Usually the normal course is you hurt your shoulder somehow. You have some pain. You may not use it as readily as you do, and then it turns into a frozen shoulder. And it's often very painful in the beginning, in what we call the freezing stage, where it's just achy all the time and it hurts whenever you move it. And then it gets to a point where it kind of plateaus, and it doesn't hurt all the time necessarily, but it hurts at the end range of where you can move it. And people literally can only maybe get this high, or they can only get this far back there. They can't bring their arm across, and it hurts just at that end range. Like if you're going to a parking garage, they can't reach the parking ticket. And so our job is to break apart those adhesions and to help you get your range of motion back. Typically, people with a frozen shoulder will get better over a long period of time, a couple of years, without any intervention. But we do know that people will get better if we do some intervention. However, if I get someone in here at that early stage when they're still having a lot of pain, sometimes you just can't quite prevent the process. Once it starts down that path, it's going to get frozen. And once we plateau, we can work with it really well. Some people get better rather quickly, 6 to 12 weeks, and then other people are a good 3 to 9 months. So we don't quite know who that person is until we work with them for a couple of weeks. We do know that it seems to affect women more than men. We also know that if you've gotten it in one shoulder, the chances of you getting it in the another shoulder at another time is highly likely. And it often hits sometime between the age of 40 and 60. So here's somebody who wrote it, came in with a frozen shoulder 2 months ago. He had trouble putting his coat on and had very limited mobility, especially reaching into his back. He says, after the first session, I started feeling better, and now he has no pain and the range of motion. He can put his coat on and reach behind his back without any pain. Here's another woman who actually said that she came to one of my talks where I talked about how it could be the bicep tendon, and she had gone to therapy somewhere and felt maybe 80% better. Yeah, she wrote 80%. And but they had missed the bicep component. When she came in, we worked on her bicep, did a little different exercises, and by the time we were done, she was able to put on her shirt that she hadn't been able to do in a long time. So that's always very nice to be able to do, then get people back to doing what they want to do. Arthritis is a different animal altogether. As you know, arthritis is a wearing away of the bone tissue in the joint, can happen in any joint in your body. And people, sometimes they'll develop spurs, which is also considered arthritis. And those spurs can rub against the tendons, which then cause fraying of the tendons. So a lot of people will have both rotator cuff tendinitis or tear along with arthritis. When people come in with arthritis, what we're trying to do is really help you to manage your pain as well as we can, and maintain and improve your mobility and improve your function. Usually what I find when people come into me, and it's really just an arthritis issue, they've already figured out what they can and can't do so it doesn't flare up. I know for myself, with the big toe arthritis that I had, there isn't much you can do. For me, it was, I had to have some surgery where they cleaned it out. And sometimes they'll do that with shoulders as well. But if we can manage it well, give you some exercises that you can tolerate and manage your pain, and maybe you won't need to go for surgery. I touched on this for a moment. Other causes from shoulder pain, it could be coming from your neck. I have a patient right now. She almost slipped on the ice, and as she called it, she flailed on the ice, and as a result, kind of strained her shoulder and her back. So we're working on both, and it seemed pretty straightforward of rotator cuff tendinitis, but then she came in and she had like this gnawing, aching pain here, which actually really was coming from her neck. So I had to work with her neck as well. And that pain went away. Sometimes shoulder pain is referred from somewhere else. So that kind of brings me to come back to here. Is your pain reproducible? So in other words, when you come in for an evaluation with either the physical therapist or your doctor, we will put you through some tests and we'll go ask you, does this hurt? Does this not hurt? We'll ask you questions like we talked about in the beginning. When do you have pain? Oh, it hurts when I lay on it. It hurts when I reach overhead. It hurts when I reach behind my back. But I can rest and it's fine. If someone comes in and they're like, I just have an achiness all the time, I can't find a comfortable position. If we kind of take you through our different tests and nothing really jumps out at us, then we need to look at other things. So we know that sometimes shoulder pain can be referred from, if you're having a problem in your liver, sometimes it will refer up to your shoulder. And so then you need some medical intervention. A story I like to tell is about 4 or 5 years ago, I started having some lower back pain on my left side. And I'm one of those fortunate people. I don't typically have back pain. I've had my occasional little bit here and there. But I was going out for a run. It didn't make it worse. So I finished my run. It was okay. By day 2, I was getting pain around the front of my abdomen. And by day 3, it was really getting painful, and I had trouble finding a comfortable position to sleep. And so by the 4th day, it was really getting bad, and there was nothing. Nothing made it worse. Nothing made it better. I couldn't find comfortable. So I knew it was not reproducible, which means it's not musculoskeletal. So I went to the emergency room because it was in my low back. They worked me up for a kidney stone. I went in, I said, it's not reproducible. It's not musculoskeletal. It's something else. Well, hours later, 2:30 in the morning, they couldn't figure it out. They sent me home with Vicodin. By day 8 or 7, it was getting better. I scratched my back and I felt a rash. So what I had was shingles. I had pain before the rash showed up. Very difficult to diagnose. It's not the first thing that doctors are going to think of, but I want you to think about that. If you're having pain that's not, you can't find a good position, it's just achy all the time, you do need to go to the doctor, see what's going on, and see if there's something else medical happening. Another interesting thing about shingles is sometimes, as you may have heard, it can come back, or the nerve can get irritated again later on. And just a month or 2 ago, so this is I had the shingles 4 or 5 years ago, I developed some sciatic in my calf, and that was weird too. Why did I have that? And it hit me. I had Kevin work on me. He's the other therapist here, and it felt a little better, but it never quite went away. But I realized it was from shingles. Where my shingles could affect the sciatic nerve. And because I had an episode of that a few years earlier, my doctor said, oh, that's the shingles coming back. So she gave me the antiviral, which took it away. So I took the antiviral pill and it was gone within minutes. That does not give you permission to take your antiviral pills, but it's to enlighten your health professional what it might be or not be when you have that pain. Okay, and my son had shingles in his armpit and his shoulder, so his arm hurt because of the shingles. So you never quite know. So we're always looking to make sure it's really musculoskeletal. This is a tip sheet that you can download off my website. I will also send it to you via email if you put your email in the chat box. Some tips on how to open a door or close a door. You want to make sure you use your body. Okay, don't pull with your arm. You want to push with your body or take a step back as you're opening. Putting on a seatbelt, that's really hard. You might need to use 2 hands, and you need to rotate your body a little bit to do that. And never talk on the phone. Everybody gets elbow pain from that, shoulder pain. So get yourself a headset. Use the speakerphone, but even that could be a problem. Oh, here's I'll send you this PowerPoint as well if I get your email, and then you'll have a link to the PDF of this PowerPoint. Okay, so what is the number one mistake people make with shoulder pain? They ignore it. So it's always better if you come in sooner than later. I'm pleased to say that in the state of Illinois, you now can come and see your physical therapist without a prescription from your doctor, with one caveat: if you are covered by Medicare, and we do treat, I am a Medicare provider. The doctor needs to sign off on my evaluations, so you need a prescription from your doctor if you are on Medicare. But if not, you can come on in and see me. And what will we do when you're here? Well, we talked a little bit about, we're going to ask you questions. When does it hurt? What makes it feel better? What makes it worse? What have you done for it? What may have caused the problem? And then we'll we'll evaluate you. We'll check your strength, your mobility. And we use a whole body approach. So we're going to look at everything. How are your feet working with your arms? How are your hips working? Is your core working? And I have to tell you, 9 times out of 10, the reason people get a shoulder problem is because their core is not kicking into gear. So we have to look at all of those pieces and really re-educate your body, which we call neuromuscular re-education, to teach your body to work together as a whole. We need to work on a lot of stability exercises to stabilize. Remember, we talked about that rhythm of the scapula. So we need to get some good stability exercises. So when you move your arm, it's moving from a stable environment. We're going to do a lot of manual hands-on therapy to calm down the soft tissue. Particularly for adhesive capsulitis, we'll be doing a lot of stretching and what we call joint mobilization to kind of break apart those adhesions. We got to give you some strengthening exercises for your core, your legs, your shoulder, so it can work better. And then we work on the coordination of all those pieces together, called neuromuscular reeducation. We'll also work on some postural activities to make sure you are sitting and standing in the best alignment so you can move your arm. People, as we get older, a lot of people tend to get a rounded upper back. And as such, if you go back, if you're able to visualize this, when your spine rounds, that scapula comes forward, and so your whole shoulder joint comes forward, which means you'll only be able to raise your arm to about here because there's no give in it. If I'm rounded here, this is as high as I can go. If I straighten up, I then can move my arm all the way through there. So it's very important to look at your spine as well and how that plays a role in it, as well as the rib cage. You know, this rib cage will get very tight. Women who have had surgery, breast surgery, they have a lot of scar tissue there. We have to look at all those pieces that can play a role into your shoulder pain. Okay, I think that's the bulk of everything. As a thank you for coming to this webinar, please feel free to set up an appointment. You can schedule a phone call or telehealth session with either Kevin or myself, and we'll talk about what's going on with you and let you know what we'd recommend and how to begin and what we would do to help you. If you need to reach me, this is my email, denise@themanualtouch.com. My office phone number is 847-541-7600. And this is my website, www.themanualtouch.com. So I'll give you a moment to write that stuff down. And again, remember to put your email in the chat box and I can send you all of this information.
Denise, we do have a question in the chat box.
Okay, I'm gonna stop sharing the screen. And oh, I am back with everybody. Okay, and before I forget, Pam, there's a way to, before you close out of here, print out the chats.
So my Zoom here is really basic. I can't do much. It's
okay. I might be able to do it. So yeah, don't hang up before I do that. Okay, what is the question?
Thoughts on supplements, turmeric, osteoporosis, Biflex, and pectin, and grape juice.
What was the last one? Grape juice? You know what? Supplements are a good thing. Turmeric is shown to be a good anti-inflammatory. Those are things you need to discuss with your doctor to make sure they're okay to use. What was the other one?
Osteoporosis, Biflex.
Biflex, I'm not sure what that is, but
it's in the chat to everyone if you want to check the
osteoporosis Biflex. Is that a type of supplement? Steve? Oh, you can unmute yourself.
Hold on.
Yeah, can you hear me?
Yep. Yeah.
Yeah, it's a product called Biflex.
Oh,
that's the brand name. It's glucosamine.
Oh, okay. I'm not aware of that, but I know glucosamine people sometimes get good relief. Turmeric is good relief. Pectin and grape juice, I'm not sure about, but maybe that's similar to like tart cherry juice. People swear by that as well for inflammation, particularly with arthritis. And most
my problem is arthritis.
Yeah. I believe, you know, you got to talk to your doctor, but if you're taking other medications to make sure those things are okay to take, I believe glucosamine is typically okay. They're all right with that, but
Okay.
let's see what else here. Dislocated my shoulder. Good range of motion now, but frequent tear-like pain in the tricep and cramping in the bicep. Okay. So it sounds like we need to, with this person, this what it looks like it's a woman, Mary. Mary, are you on here? So my guess, yeah, did you have physical therapy after you
I
dislocated?
did. I probably did. Within a few months of it happening, I finally went in and did about 10 weeks of physical therapy going in, and then I continue, the same exercises and whatnot on my own. It's gotten a lot better, but lately, it comes and goes, and I'm wondering if I need to go back and get some help.
Probably. When you dislocate your shoulder, did you literally dislocate it and had to be put back in?
I fell, I slipped towards the hood of the car. So it literally flipped over to my back.
Oh God, that must have
I
hurt.
was able to slam my shoulder into the ground to get it back into the socket. So it was,
Oh, good for you.
yeah,
It's very painful.
it was.
The unfortunate thing, and I didn't talk about this, and maybe I need to add it in there. When somebody dislocates or partially dislocates, which we call a subluxation, the capsule around that joint stretches out. And because there isn't good blood flow there, it's always a little stretched. So that shoulder joint is always going to be kind of lax. And it's very easy to be susceptible to re-injure, re-dislocate, re-sublux. And so it's really important to stay on top of your exercises. However, something like that, it's not a bad idea to get tune-ups every year or so to make sure you're doing the best exercises for you at this time and stage of your life. And look at all the other pieces, if your core isn't working as well as it used to, as we get older, our muscle mass gets a little less, our bone mass gets a little less. So it's harder to stabilize. Our balance gets a little off. So yes, in answer, it would be a good idea to get it checked out again and see where you're at, and probably getting a tune-up. A lot of my patients, when they come in, I'll tell them, particularly my older patients, maybe not so much for shoulder issues, but like balance issues or back pain, they really need to come in every year to kind of check in where they're at, osteoporosis, because, we don't want to admit it, but it is a little downhill as we get older and over a certain age. And so things get weaker and don't work as well as they used to. So
Great. Thanks.
you're welcome. Oh, also, Mary, you're talking about this cramping in the bicep or frequent tear-like pain. What'll happen, when people describe stuff like that, it usually means you're compensating, you're overusing something because something else isn't working the way it's supposed to. So you really need somebody else to come in and look at you. If it was happening to me, I'd go to my, one of my colleagues to see what am I missing? What's not working so well?
Okay. I appreciate that. Thanks.
You're welcome. Can I answer any other questions? Are there any other generic questions that other people might benefit from? Okay.
All right. Well, thank you, Denise. Denise is,
I appreciate it, and thank you.
yay. Denise's next talk will be Thursday, May 19th, again at noon. It's low back pain and sciatica. So if you're interested in that, it's already online and you can check that out. Our next talk will be next Tuesday. It's all about bunions. Next Tuesday at 7 p.m. by IBJI. They will be talking about the causes, symptoms, and treatments of bunions. Thank you, everyone, for joining our call today. It's another session for North Suburban YMCA YS talks. We look forward to seeing you at the next talk or Denise's next talk in a month. Welcome and have a good day, everyone.
Thank you.
Great, thanks. All right, Pam, I think I've got it. If you wait one moment, let me